Mr. Riney. How are you today?
I'm good. How are you?
Good. We're just going to go ahead and begin your abdominal assessment.
All right.
So for that, I'm going to first look at the area, just kind of make sure that everything's symmetrical, look for any scarring, any rashes, anything like that.
All right.
And then after that, I'm going to listen. I'll be listening for bowel sounds just to make sure everything is sounding okay. And then after listening, I will percuss the area to check for the size of your liver and making sure that everything is where it needs to be. Then I will palpate the areas. So that first I'll do light palpation, and then I'll do a deeper palpation just to be able to feel kind of all of your organs in those areas. And see if you have any pain or anything, okay?
All right.
So if you're okay, I'm just going to lift up your shirt and we're going to look at the area. Okay?
All right.
All right, and then just go ahead and keep your arms to your side for me, okay? So I don't see any issues really. I see your scar from your G-tube and from your surgery, from your placement. Everything looks symmetrical. I don't see any rashes. Your skin is nice and clear. Your venous return, everything looks good. There's no issues with your circulation. Symmetric. It's symmetric. Both sides are equal, so that's good. That means there's no anything bulging or any issues there. Okay. So if you could just lift your head up for me for a little bit, and then I'm just going to look at the abdominal muscles and look at your muscle wall. Okay. Any pain there?
Hover.
Yeah, just kind of hold it up for me, just to make sure that there's no masses or hernias that kind of pop out. Okay, good, perfect. Everything looks great. Now you can go ahead and lay back.
All right.
All right. Now I'm just gonna listen, okay? And in some areas I may listen a little bit longer, but we'll just kind of finish that up, okay?
Okay.
All right. Any questions so far?
No, ma'am.
All right. I'm just going to begin with your right lower quadrant, and then I'm going to move around, okay, in a clockwise fashion.
Should I breathe?
You're okay. You can just breathe normally. You have normal active bowel sounds, so that's what we want to hear. Everything sounds great. And then the next part that I'm going to listen to is just your arteries and just see if there's any, it's called bruise, but just to make sure that there's no issues there, okay? Okay, everything sounds great.
It's good to hear.
All right. So now I'm just going to kind of percuss in those areas like I was telling you, and basically that's just me hitting on to hear the different sounds, okay?
Okay.
Okay. If you have any pain or anything while we're doing that, just let me know. Doing okay?
Tickles a little, but yes.
Okay. Sorry, and I'm also going to just kind of look the liver size. So your liver seems to be of normal size. No swelling, no enlargement, no issues there. Your skin tone's also good, so no yellowing of your skin, which would show us that there's possibly an issue with your liver.
Sure.
The spleen is dull. The sound that it made was dull, so that's good. It just means that there's an organ there and that it's of normal size. So yeah, so that's always good. And the next thing that I'm going to do is palpate every quadrant. Okay, so first I'm going to start with a light palpation. We're going to go in the exact same way. So if you have any pain or issues while I'm doing this, please let me know, okay?
I'll let you know.
Any pain in that area?
No, ma'am.
What about this area?
No, ma'am.
Any there?
The tickling slightly elevated, but
Okay.
no pain.
No pain. Okay. Everything feels normal. I feel no masses, no bulging, nothing of that sort. no hernias. Your abdominal wall muscles feel fine. So I'm going to do some deeper palpation, and then I'm going to check around your umbilicus as well, just for any masses or hernia or anything like that.
Sure.
And then I'll kind of walk through. You no longer have your gallbladder, correct? You had that removed.
Yeah, yes.
Okay, and do you still have your appendix?
Yes?
Okay. All right, so I'm just going to palpate a little bit deeper, okay? So again, if you have any pain, just let me know. Liver size is normal, like I said. Spleen feels normal. Where your G-tube was, I don't feel a lot of scarring in that area. Everything feels good and normal.
Good.
No resistance. Any tenderness?
No.
Okay, good. And I'm just going to kind of feel here, just to make sure there's no pulsation in your aorta. I don't see any which might signal any aneurysm, those kind of things.
Oh, good.
Okay, so all of that looks great. I am going to have you sit up for me, and we're going to kind of take a look at your kidneys from the side. I'm just going to feel around the side and make sure that you're not having any pain in those areas. Have you had any difficulty with urination?
No.
No? Okay. Any difficulty with your bowel movements?
No.
And how often are they? Like daily,
Pretty
weekly?
regular. Depends on what I'm eating, but
Okay, that's good. All right, so I'm just gonna check in this area. Any pain whenever I palpate these areas?
no.
No? Okay, good. No blood in your urine, no urinary
No.
frequency, no pain when you urinate,
No.
no discharge, nothing like
No.
that, correct? Okay. Alrighty, do you have any questions for me?
No, ma'am.
All right, well thank you, Mr. Riney, and I hope you have a great day.
Hey, me too.